first order of business. Okay, strike. Like when you hear strike, what's the first thing come to mind?
Man, 3 strikes you out.
Okay. Well, in this case, you know what I'm saying? That's a good one. But well, in this case, like this ain't baseball, you know what I'm saying? And
Right.
you know, this ain't
Serious.
jail, you know,
Right,
three strikes you out type
yeah,
shit.
serious
You know,
strike.
this is, you know, workers, you know, going on strike, or, you know, employees going on strike. And we already got the Hollywood strike where the writers and you know, the actors guilds, that whatever they call it, you know what I'm saying? Like
Yeah.
all the script writers, pretty much anybody that's not an actor, people behind the scenes, you know, they pretty much striking. You know what I'm saying? Yeah, you know, they striking against Hollywood.
Yeah.
So that been going on all year. You got the United Auto Workers, United,
UAW.
the UAW, United Auto Mechanic.
It's the United Auto Workers.
Okay, United Auto Workers.
Yeah.
Well, you got that going on, and now you got the largest strike in history. It's over with now, but you know, like
The healthcare strike.
75,000 healthcare workers, you know, go on strike. That's a lot in a very, very sensitive like industry. You know what I'm saying? Like this is a hospital, or you know, nurses. You know, like just imagine if you was in that vicinity and you got sick, one of them, you or hurt. You know, who knows?
It's healthcare.
Yeah, it's healthcare. You know what I'm saying? Yeah, like,
Man.
like with like
your health is at risk. Like your care is at risk. Yeah.
So I don't know, like while they was on strike, who was at work working on you know what I'm saying? I don't know, but it seemed like a situation you don't want to be in. Could you imagine 75,000 Erlanger Memorial, Park Ridge, East Brainerd?
Man.
You know, could you imagine just striking?
Yeah, nah.
Oh man,
it'll be like our biggest.
It'll be pandemonium, man. Like,
yeah,
like we wouldn't even know what to do, type shit. Like, but you know, that's something, you know, where we ain't faced, but or I ain't seen, or you know, just know type shit.
It, like up close and personal.
But
yeah,
that's let's say if it was COVID, like let's say COVID was around, like let's say a pandemic was around, and you know, like it, you know what I'm saying, like, but we don't know what them workers, you know, going through. We don't know why. We don't know, you know, what's they, you know, motivational reason behind, like.
I'm pretty sure it's, you know, similar to what other workers just in general go through. You know what I'm saying? Just low pay, cost of living steady going up, but the raises ain't matching what, cost of living going up. You know, they trying to consolidate, and so it's creating bigger workloads, and but you ain't gonna pay me no more. You know what I mean?
You know what I'm saying? You acting shiesty on the PTO, you know what I'm saying?
Like y'all,
you know, we gotta get this shot.
Yeah.
We gotta wear this mask, you know, like it's a lot. I'm willing to bet it's a lot. Me personally, I got relatives and, you know, people that I know in that field. Haven't had a real, you know, conversation with them, but I know they still going day to day, and you know, who knows if something like that could hit near you, you know what I'm saying? But more importantly, you know, we got an article, you know, I'm gonna go into it. It's from CNN, cause like this was the largest healthcare strike in history, you know. But these are union workers, so these were not workers that didn't have representation. Your opinion, if they didn't have a union, would they have strike?
it'd have been a lot harder, unless they got the savings or the funds to,
Right,
you know
right,
what I'm saying?
right.
Because with them unions usually are typically, pay something if you go on strike. But yeah, I don't know.
So that's one thing that came to mind. At least they do have representation, and these ain't just employees out for themselves. Like, I don't think it would have been a strike.
If they didn't have
probably to this magnitude, 75,000. Like you said, being that they in the union, they probably was getting something.
See, what people I don't know, a lot of people haven't acknowledged or realized is you can unionize without being under a union. If everybody was to come together at a job and say, hey, we are demanding this, or we're all leaving union or no union, y'all can make something.
They gotta shake something. Yeah, they gotta shake something.
Definitely.
That can be a risk, because they can say
definitely.
no.
Most definitely.
But the likelihood of it, I mean, the odds in your favor if that was to happen.
You have a high enough percentage, I'm pretty sure they'll be like,
yeah, they'll be like, why go through another such and such months of hiring and doing this, calling people, whatever. But I agree though, you know what I'm saying? Workers should unite, you know what I'm saying? People. With or without.
Everyone, if people were to come together in general,
yeah. For sure. In the big picture.
Right.
You know what I'm saying? In the big picture, for sure. But for a company, at the very least, y'all are workers, so shit, stick together and, it's strength in numbers.
Most definitely. It's power in them numbers too.
Yeah.
Yeah, most definitely.
So this was, as you would say, the largest healthcare strike in history. You know what I'm saying? I'm gonna go ahead and read the article from CNN real quick. More than 75 unionized employees are returning to work at the historic 3-day strike. So, strike didn't last that long, 3 days.
But that was 75,000.
Yeah, but that was 75,000. They got right. They got right. And this had to be over a nice population. Like this.
Man.
I couldn't imagine this being in the same city.
Yeah, no, like
this
cities wide, like spread.
Yeah, this had to be a couple
states wide.
You know what I'm saying? At the least.
Yeah.
You know what I'm saying?
Something I ain't did the detail as far as
But an even bigger, longer work stoppage could be just around the corner. This week's temporary work stoppage, the largest healthcare strike in U.S. history, concluded at 6 a.m. on Saturday without a deal. So they went back to work, but they don't got an official deal. So I wonder what made them go back to work. Did they promise them something? Did somebody drop some quick bread real quick? What was the play on that?
Them companies do what they want to do, especially the larger ones. Healthcare is one of the largest. You know what I'm saying? Umbrellas for real.
For sure.
Because it's so much that falls under them.
That's where you at when you come in this bitch.
Man.
You know what I'm saying? So that's very important. You know what I'm saying? For the most part, that's where most people born in the, hospital, healthcare workers. You know what I'm saying? So a spokesperson for the coalition of unions representing a broad spectrum of the employees included receptionists, dietary workers, nursing staff, pharmacists, and clinical lab scientists, told CNN that strikes may resume later if a deal is not reached. The union confirmed to CNN that negotiations will resume Thursday. Alright, so Thursday not here yet, but on Saturday they came to some kind of agreement to go ahead and go back to work.
Man, and that may have been the largest as far as healthcare, but I did read that there was a strike that lasted 11 years.
Now that's a long time.
Imagine being on strike 11 years.
That's a long time.
Paid or not paid at this point, 11 years for one company.
Damn.
Yeah.
Yeah, that's big.
It's wild right
That's
there.
wild.
So I'm just like, what did they do? Like, y'all have to go get jobs somewhere else. Like, ain't no way.
Like, a couple questions popped in my head.
Man, I have questions.
Yeah.
Let's talk about it.
We can probably get to that. Following this historic work action by tens of thousands of frontline healthcare workers in response to unfair labor practices, we are hopeful that the company will refrain from any further violations of federal labor laws as we resume formal talks on Thursday. Georgette Bradford, a Sacramento, California-based Kaiser ultrasound technician and union member, said in a statement issued late Friday by the coalition, frontline healthcare workers remain ready to continue taking the necessary steps to protect our patients from the dangers of the Kaiser short staffing crisis and to defend our rights. So they standing strong. Well, they stood strong, and they had, like they said, they had nice representation in prominent people like ultrasound technician and union member. Like, they had prominent people like on the front lines. They were striking as well. Like, you know what I'm saying? They were part of trying to get, you know, better treatment, better, you know, wages, or just whatever, you know, take the mask off, I can't breathe, whatever, you know, whatever they wanted, right. You know what I'm saying, to go down. And let me go ahead. Where do negotiations between Kaiser and the union stand? Well, the strike took place in California, Colorado, Washington, and Oregon. Nearly 200 employees from Kaiser facilities in Virginia and Washington, D.C. also went on strike for 1 day on Wednesday. Yeah, so like I was saying, 75,000, like that couldn't have been in one little spot. So this was like, you know, United States wide pretty much. A lot of it on the West Coast, from what it looked like, besides D.C. and Virginia. You know what I'm saying? But they spread it out, and they all got on one page and took the strike. Man. At issue, the Kaiser coalition, the union said, are concerns by the pandemic related to unsafe staffing levels and pay that hasn't kept up with skyrocketing rent and gas prices. Now that's something Kate Nicole just mentioned. Man, you know, the cost of living going up and up, but you know, these wages ain't keeping up. You want overtime, you know what I'm saying? You want, I gotta be here a little early, stay a little later, you know.
Man, what about the flip side? Everything going up and they deny overtime. They're not even allowing overtime.
Yeah, they not even allowing. You know what I'm saying?
Yeah, you're not even.
In some cases.
Yeah, you're not getting the raise. You can't get no overtime to make up for it. Like, yeah, there's a lot going on. The math ain't mathing for me. I need something.
Right.
Yeah.
But like, just being the largest in the world, and just seeing like that many people on one accord on about a common goal, like. I think that's what's up. Yeah, I think that's what's up. You know, I think other companies might be watching this. You know what I'm saying? Other, especially healthcare like companies, they probably watching real close and
taking notes.
Yeah, taking notes. Like yeah, we ain't finna have that.
From all aspects.
You know what I'm saying?
Like, hey, how can we prevent this from happening for our people to not
leave? For sure.
And then the ones looking
it
like,
might just be some little raises going on here and there.
Yeah.
Real quick.
Randomly.
And you know, companies like probably not like government ran like a healthcare facility, hospital type of thing, like, but just big companies with a lot of employees might be looking at this shit too, and trying to, you know, like take notes and see who and what got involved and how we, you know, Try to find out what was the negotiation, why they even went back to work in the first place.
Either how can we avoid it, or how can we join it?
Yeah, how can we find out that juice right there? Because we want to, you know what I'm saying, we want to use that to our advantage.
So if that $500 a week to be on strike sound real good right now, and I got to be slaving.
Oh, man.
And you gonna negotiate my contract for me, and bring on the union for me. Let me see what they talking about. But yeah.
I think a lot of jobs should have a union, a lot more jobs, but that decreases, you know, profit for the company. A lot of things they won't be able to get away with, you know, with a union, you know. So we'll just have to see if, you know, things get better. But right now we'll just keep an eye on it. Like they said, they back at work, but just for now, they have not reached the deal.
So
you know what I'm saying?
I wonder if they can go on strike again. Like,
shit, you think they won't? They already done showed y'all.
Well,
like, look,
I mean, yeah,
don't play.
Are there rules to it? Like, you can't go on strike in the same week now.
Yeah,
you know
go on play with it. You know what I'm saying? Go on play with it now. We already done showed
what
you.
they want to do, yeah. Definitely.
You know what I'm saying? So I think something gonna happen, but who knows what? Will they be pleased? But I think definitely something gonna happen.